Welcome to Long-Term Care Policy and Management. This is Public Health 627. Welcome to Week 2. Last week was your introduction video and your Week 1 video. This week we continue a discussion about the fundamentals of long-term care. We start to think about the system as a whole and our priorities within the system. Of course, since this is the start of the course, it's hard to put all of this in context. I'm never a big fan of starting with the big picture things at the start of the course, but that's how the text was written, so that's what I'm doing. If some of these materials seem abstract to you, please don't worry. It will make more sense moving forward. A lot of Week 2 is about what policy choices we've made or should make about how the long-term care system works. One of the big questions this semester throughout the course is, does long-term care work? As we progress through the 14 weeks, ask yourself if the system makes sense as it is, or if the system's parts make sense. If we're going to make changes to long-term care, what would we do? How could we improve the long-term care system? Almost every legislative session in every single state in this country has a debate about long-term care every year. So if we are to make changes, what would we do, and what we use for a sense of grounding or a set of beliefs around what long-term care should look like? The book provides us with some structure to do this around Week 2, so let's jump in. A couple of other issues that the book touches on. The text this week discusses Obamacare or the ACA early in the reading. You've probably talked about Obamacare and the ACA in other courses, and I'm sure you will, so we're not going to go into depth. What you should know in this course is Obamacare and its effect on long-term care policy. We focus on the Class Act in this section. The Class Act was a major change that was going to be made to long-term care. However, the Class Act didn't pass, basically, and you'll read more about that in the text. So as far as Obamacare affecting long-term care, the big impact didn't pan out. However, I want you guys to look at the Class Act because that idea or a similar idea is undoubtedly going to come back in the future. I've included this quote in this slide. I don't like Obamacare, but I do like the Affordable Care Act. As you probably heard, many people don't know that they're the same thing. Studies have shown that Americans think that Obamacare and the Affordable Care Act are actually two different products by Congress. Another note on the Medicaid expansion. Again, this is something you probably go over in other courses, but if you didn't, or you're just starting out, the ACA kind of incentivized every single state to expand their Medicaid program so that all the states were using similar formulas and covering similar populations. That was going to impact long-term care because, as you know, Medicaid is what covers long-term care. Well, the ACA was challenged in court, and the Supreme Court held that the incentives that they were using to make states expand their Medicaid programs were not valid. So that is why we got here, which is where some states have a Medicaid expansion and some states didn't. The states who opted to expand early took a lot of the benefits. The states that did not expand early but are now kind of expanding now are reaping some of the benefits but not all. So the point is, Medicaid, we tried to make Medicaid similar in all 50 states. That didn't happen, and now we kind of have a more individuality than we did before. So that didn't really work. So the big point this week is the text criterion, the 6 criteria for designing or evaluating a long-term care system. I wanted to start out with this criteria because it is a good way to think about how should we do long-term care. It also really helps you think about at the end of the semester project when you're going to make a suggestion for a long-term care change, where the changes could be and how you would base that on some foundational principle. So they're just helpful for understanding the possible goals of the system. A lot of the criteria look like patient rights. Those of you who work in hospitals or healthcare systems, you'll notice that the criteria and patient rights look very similar. I do want to point out that long-term care patient rights tend to be much more expensive than hospital patient rights because you've got that added rights, responsibilities, protections because people live in these facilities. So sometimes you see some overlap with the housing rights that you would see in addition to regular patient rights. So I'm just going to go through the criterion 1 through 6 and give you my added notes. The first criteria, the long-term care system should be based on a recognition of needs, rights, and responsibilities of individuals. Again, this is really important. Long-term care consumers basically live in a facility as opposed to hospital patients who are temporarily in a hospital. So what you see here is an acknowledgement that the system should look a bit like someone's home and include all those extra rights, responsibilities, and benefits. The caveat is there's inevitable balance between really recognizing people's rights and the realities of this limited system. So you want to, in long-term care, there's this difficult balance between respecting someone's door to their room as though it's their own home, but balancing that against the fact that they probably share that room with another patient, that nurses need to enter that room, that there's certain things within that room that are not owned by the individual. So some examples are, we would want to provide bingo to every single resident at the time that they choose, or let the resident choose a shower at whatever time of day they would want a shower or on whatever days they want a shower. But that really has to be balanced against the rights, needs, and responsibilities of the facility that they're in. So I just wanted to give you the other side of that balancing act. The long-term care system should be easily accessible. Absolutely. And we're going to talk about that a lot this semester. But I wanted to point out that there are 3 multiple components to entering the long-term care system that makes this really complicated. The clinical component, are you sick enough? The financial component, who's going to pay and how much they're going to pay? And the choice component, does the resident or the consumer actually want to be there? I think the caveat to the author on criteria 2 is because it involves these 3 things, the paperwork's never going to be simple and easy. My comments on criteria 3, the long-term care system should coordinate professional, consumer, family, and other informal caregiving resources. Absolutely. A lot of times we want to create kind of across the continuum care between professionals, non-professionals, family members in long-term care. And this might be another thing that you guys think about for your final project. In practice, this is really difficult, right? Because a family member goes into long-term care where the long-term care facility doesn't know what kind of care the informal caregiver would provide. They're not really expected, the informal caregiver is not expected to be involved in care. There's no real mechanism for institutional knowledge to be shared, so if someone's been taking care of their mom at home for 10 years, there's really no long interview process for mom's care knowledge to be transferred to the nursing home. So I agree that long-term care should be coordinated between professional, consumer, family, and other informal caregivers. However, the caveat on this one, just to remember, is this is an emotionally jarring experience for humans. It's a lot of strife, a lot of disagreement, a lot of misunderstanding, and a lot of knowledge that's not passed on. So the long-term care system should be an integral part of the health and social system to promote integration, efficiency, and cost-effectiveness. This is criteria 4. Absolutely, we need good communication between all the providers along the spectrum. Integration is really important, but the question is always going to be with who and when. My caveat for criteria number 4 is whenever we see efficiency and cost effectiveness as a goal, we really could be talking about how to do more with less, which is really hard because in long-term care, we're already doing a lot with a little. So my caveat for this one is, yes, we should have really great integration across the spectrum, but when we talk about efficiency and cost effectiveness, what do we cut to make it less expensive? Criteria number 5 is the long-term care system should be adequately and fairly financed. So this is really connected to criteria 4. We know the costs of the long-term care system are really big. Private pay and government pay are very different systems, and rates can run in the long-term care system from $3,000 a month up to $15,000 a month. I mean, it's really not uncommon to have a very specialized unit that might be between $30,000 and $40,000 a month. So my caveat for criteria number 5 is it should be adequately and fairly financed. However, the system's already too expensive for anyone to kind of private pay, especially if you need specialty care. So how do we fix that? That's one of the big questions with long-term care. Criteria 6, the long-term care system should include education component to create informed consumers, providers, reimbursers, and regulators. Absolutely, and that's really what we're doing in this course. However, we can see that educating the public about long-term care would be really complicated. It's a great idea, but this system is complex for multiple reasons. Most people aren't interested in learning about long-term care because they don't think or hope that it's going to affect them. So it's too complex really to explain easily, and you often lose your audience. Let's do a quick review of the terms this week. Medicare, as you know, is the government insurance for 65 and older. There's some specific groups in there. Medicare pays for skilled rehab but does not pay for long-term care. Medicaid, state government health insurance, who is supposed to pay for those unable to afford health insurance in some specific groups, does pay for long-term care. I just like to reiterate that until it's burned into everyone's brain. The Class Act, you're introduced to that this week. It was an attempt to create a long-term care insurance pool under the ACA. Didn't work out. ACOs are accountable care organizations that use a bundled payment from Medicare that would probably include the hospital and nursing home. The idea behind ACOs is that if someone falls and breaks a hip, they come up with a number for how much that should cost, like $70,000. And then the hospital, the rehab, the nursing home, the home care, they all share that $70,000 to get the patient back where they were. Advantage plans can be really complicated. We'll talk more about them in the future. But these are private plans that you opt into under Medicare through a private company. So if you're 65, you're now qualified for Medicare, you can buy an Advantage plan that works just like Medicare and Medicare works with, instead of just utilizing the federal government. Readmission, if you don't know what that term means, the author uses it a couple of times. Readmission's when a patient has to go back to the hospital within 30 days because they got sicker instead of getting better. The ACA now places penalties on hospitals for those type of readmissions. So that's one of the things hospitals are really cautious of. So check out some of the exploratory readings this week and feel free to skim that information. Really, the criteria is the focus of your discussion this week. They're really going to help you think about your final project and kind of where you're being drawn to. I wanted to give you the caveats just to let you know that none of these criteria are easy. There's always a different side to the story for everyone. This week is also about strengths and weaknesses. Continue to think about the strengths and the weaknesses of the system. This is going to help you get started for your final project and think about where improvements really could be made. What could be fixed? What's jumping out at you at this point? Maybe something should be discontinued or scrapped entirely. If you want to have office hours with me, please feel free to reach out and we can schedule that over FaceTime or voice thread. So that's it for week 2. I hope that answers some of the preliminary questions. As always, you can reach out to me by phone, email, text, whatever you'd like. I'm here for your questions, comments, or concerns. And good luck with week 2. Thanks.